Prostate enlargement. This is an issue at the moment, especially with men, and the issue starts when men get up to, from 50 years old and get older. As they get older, the prostate enlarges, and there are some reasons for that it happens. And from statistics, apparently 1 out of 2 men will actually suffer from that problem. So I'm going to talk about it. This video is in 2 parts. One is an overview of the prostate, the enlargement, what it is, some information about it so that you have some clarity before we go on into solutions. And what are the challenges that happens when prostate is enlarged, and what are the dangers that could happen, and what you can do to reverse that. So I'm Alan Wannitz. I'm a nutrition expert. I help people restore their health with the use of nutrition. I use nutrition to help them reverse their problems, their health problems, and find ways to get them to become less dependent on drugs and medication and live a drug-free life and healthy and back to normal, back to your ideal state. Ideal state means like when you were 20 years old, you had high energy levels, you had lots of vitality, memory was good, lots of concentration. So I work with you to bring you back to that. So what is the prostate? Where is it located? It's located under the bladder. I made a drawing. So here's the bladder here, which stores your urine before you go to the toilet. And the prostate wraps itself around the urinary tract, or the urethra, which is the tube which goes from the bladder down through the penis in and out. So here it is, here right under. It's this little tube, it's a gland which wraps around it. So what it can do, it can actually press that tube and close it when it enlarges, and that's where the problems are, when that closes. So what is its function? It's got 2 functions. It's 70% gland and 30% muscle. So what does the gland do? It produces the fluid that keeps the semen liquid. So what happens is, in this diagram here, there's the testes here. The testes, the sperm is made, and the sperm travels into the prostate. And in the prostate, it nourishes the prostate, it nourishes the sperm, it fertilizes it, and keeps it fluid in liquid form. And it transports the sperm. So that's what it does. On the muscle side, it basically pushes out the semen during ejaculation. So that's what that muscle helps to, and it controls also the bladder. So if that muscle is not working, you're going to have bladder problems. You're going to have incontinence, where you can't control the urine. You have no controls there, so there's a problem there. So that's what the function of the prostate does. Gland for the production of semen and nourishes the sperm, and muscle for controlling the passage here through that tube. Now, what happens when it gets enlarged? So by the time you're 50, a man is 50 years old and gets older, that problem actually can surface. So what you can do about it, and what are the challenges that happen there? So the challenges that happen, and the problems that men experience with this, they get uncomfortable urinary symptoms. They have a frequent urge to urinate. So it becomes a bit troublesome, because you've gone to the toilet, and half an hour later or an hour later you need to go back to the toilet. So let's say you need to drive for a while now, so now you need to go and find places where there are toilets all the time. So it becomes a challenging thing and very frustrating. You can't urinate because here now, that tube now is blocked, because the expansion and the growth of the prostate, the enlargement, is now blocking that flow of urine now. So you can't eliminate the urine that's sitting in the bladder. It's because you've got blocked urine flow. And from that happening, you can start getting infections here and infections in the bladder as well. So there's it sort of sets one up for trouble. And at night, you get up many times at night, because the bladder has not expelled all the urine. The body gets a message to need to eliminate this. So you get constantly woken up at night. Now, there's 2 problems here which are separate. There's what is called the enlarged prostate. One is called BPH, Benign Prostate Hyperplazia. There's no problems there, it's just that's very irritating, so because of the growth. But what can happen, it can lead to a cancer which has different symptoms. So if cancer is set in, sometimes with cancer there's no enlargement, so there will be urine flow but no enlargement. So how do you make the difference between the two? The cancer, what can happen, the symptoms means there will be blood in the urine or in the semen, pain and burning during urination and pain during ejaculation, and poor or no erection. So these are sort of symptoms that cancer could be there, mainly the blood. So when these challenges are present, so the question now is, what can one do about it? So this is where I come in and I give some answers to you on that issue, on how to work on preventing this from expanding, or if it's expanded, what nutrition can you use to break down, to remove that growth or that enlargement. And there are also some medical procedures. So before we go to medical procedures, before I show you the medical procedures, let's have a look first at the nutrition. What foods are creating this problem? What junk foods are you taking that's creating this problem? There's other issues in the diet, and then there are factors there's 4 factors here that actually create the problem. So it's not only one factor, it's not only diet, there's other stuff as well. So number 1 would be diet. So diet would be junk foods, what foods you eat, what food you should eat, that will reverse all these things. There's stress. Stress creates a lot of problems. It creates hormone imbalances. So when there's hormone imbalances, the growth happens as well. So there's some nutrition that you need to apply with stress as well. Alcohol creates also problems. The alcohol creates problems with the liver. What happens with the liver? The liver actually starts creating hormonal imbalances, and one of the hormones that gets produced because of alcohol is estrogen. So you get estrogen dominance, and estrogen dominance is a hormone that actually creates growth. So if there's an excess of estrogen from alcohol, estrogen also from stress, it creates the growth. So there's a few things that one can do here to start eliminating those problems. And also another factor, a 4th one, which is medications. So if you're on diabetic medications, blood pressure, cholesterol medication, ulcers or indigestion or IBS medications, they have an effect on this. Medications, the effect of medication usually is affecting the liver. So liver is going to be one of the main things that I'm going to talk about in the next part of the video in terms of the solutions, because when you fix your liver, you are actually fixing the management or the control of the hormones. So in the solutions, I'm going to talk about 2 things. I'm going to keep it separate. One, I'm going to talk about the BPH, which is the benign part of the growth, and what are the nutritional solutions to that, and on cancer, there is a separate set of solutions that you do for reversing cancer. And then I will talk about the medical procedures. So let's get on to the second part of the video, which is the nutrition solutions to this problem.